The search for the perfect plastic surgeon can be like looking for a needle in a haystack, especially here on the Suncoast. With constantly evolving procedures, techniques, and recovery plans always changing, it's important to do your research. Joining us now to talk more about the latest techniques when it comes to breast augmentation and all the services that Holcomb-Kreithen Plastic Surgery and MedSpa provides is plastic surgeon Dr. Marc Salzman. And ladies, if you could introduce yourself and tell me your position as well.
Yes, my name is Haley Weingart. I'm a board-certified physician associate.
All right.
And I'm Erin Alonso, and I'm a board-certified nurse practitioner.
A true professional team at your, providing your services. That's one thing that we like. Let's start from the very beginning. Why is your practice different, doctor?
Our practice is different because we have almost 100 years of combined surgical experience between the physicians, and we have a group of physician's assistants and physician associates and nurse practitioners that do the latest and greatest techniques using the most modern lasers and light sources available under the auspices of our guidance. So it's really a unique setup.
Let's talk about one of your more common or popular procedures, breast augmentation. Talk to me about the new technique that you use, if you can.
The most modern way of putting in a breast implant is using a Motiva implant, which is relatively new to the United States, using a technique called Preservé. And it's been looked at now by one of my junior residents at Duke. He described something called the circummammary ligament. And there's a little attachment ligament that attaches the breast tissue to the breast, to the chest wall. And if we respect the confines of that by putting a smaller implant than we've been used to putting in, it kind of stays in place and we can put it in a more natural position instead of below the muscle where it may animate, or below the fascia where it's not necessary. It's now kind of inside the breast. And because this newer construct of a breast implant flattens when the lady lays down and becomes more full at the bottom when she sits up or is upright, it looks more natural. It looks more like a real breast.
Yeah, that was going to be my next question. What does that mean for the person getting the implant? You're talking about, is it quicker recovery too from the surgery? Is it also a more natural look that we're getting with the breast augmentation?
Yeah, it's a much more natural look. It's a tiny little 2.5 centimeter incision. It can be done under a local anesthetic. We put what's called a tumescent infiltration in, so it's a very dilute numbing medicine that's put in under ultrasound guidance directly in the space where the implant goes, and then we put an introducer in that makes kind of a tunnel, and once the tunnel's made, we put a balloon in, and the balloon bloodlessly dissects this pocket or space for the implant, and then we use an introduction sleeve, and we kind of insert the implant atraumatically and put 2 stitches in. The whole thing takes 15 minutes.
That's crazy. What an incredible example of you guys having the latest and greatest technology. Speaking of, I do want to introduce and talk to you ladies about the fact that you are a med spa. What is the main, I know this sounds like a silly question, but what is the main difference between a spa that you would find like in the yellow pages versus a med spa?
So as a med spa, Erin and I are board certified advanced practice providers. So we work under the direct and indirect supervision of board certified plastic surgeons, which I think helps us to provide quality care for our patients and also customized.
So what kind of services can you guys provide at the med spa?
So we do all kinds of medical aesthetic treatments. We have a vast array of different lasers for resurfacing, skin remodeling, and then we also do all the injectables for rejuvenation.
So the full package. Let's talk on one of those laser treatments if we can right now, because I'm seeing some of these before and after pictures and I am blown away. Talk to me about that.
So Halo Tribrid is one of the latest and greatest lasers that's come about. It's really comprehensible. So it takes 3 lasers in one treatment, which is really nice.
And what are some of the things that it takes care of on a patient's face or in other parts of the body?
So it's 3 laser wavelengths that are fired kind of simultaneously. So we're able to remove some of that surface tissue, some of the epidermis. We're also able to put some thermal injury in both layers of the dermis. So we're able to treat superficial and deep with one laser. So it's going to address everything from pigmentation, pores, fine lines, wrinkles, and collagen production.
So when the patient leaves, I mean, what is the overall goal? Tighter, cleaner, more even keeled skin or even colored skin?
It also gets reds and browns, so your tone is better.
Yeah.
And with this newer technology, we're able to cover much more surface area than we used to. We were 20–30% surface area. Now with this laser, you're rolling it on. The ladies can do 80% in one treatment. So you're getting a faster to the end point with less downtime.
All right, I love it. I love all of it. Sign me up. All right. Well, you can get more information at hkplasticsurgery.com.